Resistant hypertension, role of renal denervation, lecture with a living and box demonstration. It will be given by none other than Srinivas Kumar, who is our course director and is the person who has started this BCS also.
As we are running behind the schedule, I'll not go through the full lecture. I'll cover up some of the important aspects and highlight what is about new about renal denervation and where could be useful. And again, I wholeheartedly say that it's very difficult to talk after Dr. Venkatram. He's such an expert and such a very good speaker. We all would love to simulate him, but it's not possible for all of us. We are indeed honored to have you here, sir, and thank you very much for all your support in all our programs. And one line of remembrance about Dr. Venkatram, when we were students also, he used to come in between to give talks. So it is no exaggeration. Really, we used to feel like that. When he came and spoke something on beta blocker, then we thought that is the only in drug for hypertension, nothing else. Then once he is so effective in communication, then once he came and spoke about alpha blockers, that's the only talk I still rings in my mind, that alpha blockers, because he showed some advantages of lipid reduction, so on, where a lot of things were told at that time. Then we thought that is the best. It is very important to be so powerful speaker, so as to have bring the points in mind. That's why we thought the latest guidelines of European Society, which have come up, he could highlight it very well. And then this is renal denervation is again a new therapeutic procedure which is coming into the armamentarium of treatment of resistant hypertension. This slide brings you best wishes from Continental Hospital. Then I would skip many of the slides, excuse me for it, some of it is already covered. Dr. Venkatram gave us an opportunity to write one of his chapters in the books in a recent ACC thing which was done, Renal Sympathetic Denervation Application Resistant Hypertension and Beyond. That book got recently released, and one of the pharma companies I think is distributing. I think just briefly to mention, recapitulate, resistant hypertension is uncontrolled blood pressure in spite of 3 drugs, with one of it being a diuretic. And then normally this is what are the values which we know. In diabetics, they said it is slightly less. And again, with the changing guidelines, it could go back. And CKD, again, anything more than 130 by 90. Then in most of the trials with renal denervation, I should say that they have taken patients of more than 160 into the entry point. Then not go into details of others, then I directly go into renal sympathetic denervation. When experimentally it was known that when surgical thoracic lumbar sympathectomy was done, pressures were falling significantly in patients. But the problem was patients were developing hypotension, they were coming in wheelchairs and things like that. So if we can just modulate without removing the innervations totally, then it could help in hypertension. That was the concept. Then renal arteries serve as a source to have an approach to modify this innervation of renal arteries. This is basically, this is the Ardian Medtronic Ardian catheter, which is a 4 French catheter. The procedure is quite simple to be done. It is done through right femoral artery. This is the guide catheter, and this catheter is passed into it. And then series of RF lesions like this are given from distal to proximal. So only precaution we need to take is should not give all the lesions at one point. That could lead to renal artery stenosis. That's why the methods described is a helical pattern. You are supposed to produce 5 to 6 lesions on both sides of the kidneys, and this is found to be initially very beneficial. Initial simplicity, that was the one which is trial which was done, showed that it works. The proof of concept and safety is also proved. Simplicity 2, again they randomized one group into the renal denervation, other group only on medical therapy. Again it found to be efficacious. Then this is the picture of one of the catheter. I'm not going into details of all the procedure. This is how it looks on the fluoroscopy when you do it. Then this catheter tip can be directed depending upon the sidewards. It can be controlled, the movement can be controlled from outside. So procedure wise it is not very difficult to do. It's reasonably simple, but it is yet to be approved. I'm skipping some of the slides. Basically, a simplicity 1, I said it is proven safe. Many nephrologists and even our DCG has concerns that whether it would produce damage to kidney, and Dr. Ram is also again on the expert committee. to say that it doesn't produce damage to kidneys and it's proven beyond doubt and of safety. And then you have long-term data coming up for about 2 years that this procedure is effective, and now 3 years follow-up data also has come that not only when it is done before, people criticize that these renal nerves could again re-innervate, leading to increase in hypertension, but as of now the 3-year data showed, 2-year data is one, now you have 3-year data to show it's a sustained decrease. As I mentioned, Simplicity 2 is a randomized study which shown that compared to the group in which only drugs were given, procedure done patients had significantly better fall in blood pressure. Then people went to criticize this procedure saying that it could be placebo effect. So now the Simplicity 3 which is being planned is basically to see patients are taken into lab, then the procedure is done, a sham procedure. In one group, other patients is really RDN is done, and that study results are yet to be out. This is what is the Simplicity 3 2:1 randomized pattern in these patients. That's how if you mark those lesions, it produces like that. I'll skip a lot of the talks, and finally in the end I'll show you. This renal denervation is also being tried in various other aspects of heart failure, atrial fibrillation, ventricular tachycardia, sleep apnea, obesity, so many things. And now the further advances is whether it can be done only with RF energy or ultrasound energy catheters. Even newer versions have come with ultrasound energy delivery and it's found to be efficacious. Other thing is the old guanethidine, that is another drug which was used very popularly before, is again imprinted onto the balloon, and when it is inflated, that gets deposited into the renal artery, could act like a chemical sympathectomy. That's also being tried. This is a picture of ultrasound renal denervation. So this field is very bright and very exposed. A lot of new companies are coming up. This slide shows so many companies are working on these aspects. The Simplicity is a Medtronic which has maximum data. Enlighten Heart is St. Jude's. Vasix is Boston Scientific. One Shot is Covidian, and Paradise is Record Medical. There are so many devices are up to come to the market. But unfortunately in India, we are just part of one of this, about to become one of this trial. This shows us one of the other devices. This is, as I've shown before, the newer versions, it's totally like an angioplasty where you inflate the balloon and all the lesions can be delivered at once. So some of these shows. I would like to end by showing this European Society guidelines, which is again May 2013, where this procedure should be done. As a physician group, I feel it is very relevant to know when to refer these patients for renal denervation. Office-based blood pressure more than 160. They said it's more than 150 is enough in patients with diabetes, but as of now in the newer trial which we are doing, diabetic patients are not we are excluded to be more safe initially, but recommendations wise is like that. Use of 3 or more antihypertensive drugs in adequate dose and combination, including a diuretic. Then have attempted to modify blood pressure with lifestyle changes. Then secondary hypertension obviously needs to be excluded. And then a patient should not have a normal renal function and then a normal renal anatomy. If a patient has a renal artery stenosis or small renal arteries, we can't do this procedure again. But I would like to say, though in India it's not yet cleared, but in other countries, and yesterday I was discussing with Horst Sievert in Germany, they already started doing these procedures for moderate hypertension patients. Now it need not be always resistant because now it is proven safe. So as the procedure safety becomes more established and becomes more efficacious, we could see a day in future where young people who do not want to take tablets probably could be offered this procedure electively as a procedure of choice. I think with this I'll conclude, and probably if any physician or doctor has anything to know on renal denervation, I could just spend 1 or 2 minutes in the interaction, and then we'll go on to further lectures. Thank you very much.
Thank you very much, Dr. Srinivas Kumar. You were given half an hour, but you finished in 10 minutes. That's very nice.
Just have to adjust.
One or two points which I thought, how long does this effect last, number one? And number two, can we repeat this procedure?
Yeah, this is what is the mind bothering question, because once you are ablating this, in general body has a tendency to repair it back. So people criticize saying that once you are ablating this, whether the renal nerves could be re-innervated in the renal arteries. That was there, that worry even continues, but as of now, we have 3-year follow-up data where it is found to be efficacious. There is no further increase in pressure after this procedure. But as we keep following it up, we become more confident. As of now, for 3 years, there is no evidence of reinnervation. Then these patients are still maintaining blood pressure. One more heartening thing which is noted is, as the time course is going, the blood pressure is getting better control. If you analyze that from 1 year to 2nd year, there's slightly more better fall in blood pressure. That is one welcome thing for patients. Regarding your point of whether it can be done again, this is quite safe procedure basically, because it's a 4 French catheter. Anybody who can do a renal angiogram can do this procedure actually. So even the novice, new people, technically it's not challenging. And the device has its own inbuilt capacities of safety. Suppose if you can't deliver more energy also, there's a cutoff in it. So even inadvertently somebody is doing more energy delivery, it will get its cut off. And even is not opposing properly, again it has a mechanism to secure itself. So that way it is quite safe. The second-time procedures have not yet been studied, but necessity is not found as of now. But even if it is required, it can be done. There is no problem.
Are there any clinical indicators which will suggest that these are the group of patients who will help?
Yeah, this is basically as of now, which patients it helps is like whichever patient's blood pressure is not controlled in spite of 3 drugs. But as I said, in Europe, they are already started using it for moderate hypertension. So wherever hypertension control is efficacious, it has to be efficacious. The point I think what you wanted to drive is there any parameter to say that procedure is done effectively? That is where the research is further going on. Now we deliver 6 lesions this side, 6 lesions this side, and we're coming out. But sometimes it could be that procedure is not done properly. So as in any technique, if this procedure is also not done properly, then it may not be efficacious. So we are trying to find out a parameter in which to say that once this procedure is done, that amount, that suppose they have tried various catecholamines, urinary metanephrine levels, various VMA levels, but there are no definite evidence that after this procedure it is falling consistently. Though they said renal hormones are decreasing, metanephrine is decreasing, but consistently, suppose below this point if it falls, then procedure is done successfully. Or if you can have some imaging method where it is done very well, definitely, then that is where the research is going on. But as of now, because the procedure is safe and proof of pudding is eating it type, basically pressure is decreasing. That itself suggests that it is done well. But one more point we have to notice is pressures do not fall immediately also. Though in about 12 patients which we did, pressures did fall. About 3-4 of them there was immediate fall. But the data shows that it takes about 2 to 3 months time for the pressures to fall. So it is not that immediately after the procedure is done, suppose in angioplasty, once the lesion is there, you open it up, you know that vessel has improved immediately. Like that, we don't have a parameter immediately on table to monitor this. But basically, if pressure is decreasing, then that means it has worked well. So that is the only way as of now to make it out. Sir.
Well, sir, after a successful renal denervation, the pressure remains high. Obviously, the message is very clear that the patient need not have to stop all the drugs. They need some drugs. Now, what are the other agents which have to be chosen for control of blood pressure? Can we give safely the drugs acting on the sympathetic system, or we have to avoid sympathetic system drugs? Number two, sir, in India, what are the various centers and what is the bulk of work and how much experience is there so that we can know, we can think of referring also the cases?
In Hyderabad, CARE and Continental are selected as centers. I was there before that, and then when we moved here, that is being moved. But I should say that at any time we are likely to start. We have not yet started. There are other 12 centers in the country which are approved for this procedure as of now. The good thing is once it gets started in this month, then procedure will be offered free to these patients as a part of the trial. It has not come into clinical practice. The device is not freely available yet in our country, though it's unfortunate that in other countries about more than 2,000 patients procedures are done, but still our DCGA is strict on it, it is not being done. Regarding the other point of which drugs to be given, fortunately in 80 to 90% of the patients it is effective. In other 10% of the patients in which it is not effective, again it becomes like any of your resistant hypertension patients. Again with the trial and error methods you keep modifying. But maybe as you said, because renal sympathetic denervation did not work, these are the subset of different pathology of patients where the sympathetic nervous system is not playing significant role, then maybe you will try other type of drugs. But many of the times in resistant hypertension we see when you add a sympathetic acting, centrally acting drugs, again it could benefit. So, but in this subset of patients, we know they are not already response to this therapy, then probably you should go for a calcium channel blocker or any other drugs as by trial and error basically. There is no recommendation as such. If this doesn't work, this drug should be given.
Do you have any data that if these patients go into shock, for example, many of them may develop acute myocardial infarction, does the recovery of shock interferes in these patients who have undergone denervation because they will not be able to raise their blood pressure because of denervation?
This is another point, point initially of suspicion, criticism was raised. We have a very intelligent colleague with us, Dr. Krishna Reddy. When this was discussed before, he said, again, we will alter the same before it was raised in discussion. Whether shock, because what sir is mentioning is basically sympathetic nervous system is needed to protect our body in some situations like shock and wherever there is a problem. But this here, we are not knocking off the system totally. Then if you are knocking off totally, it becomes like a surgical thoracolumbar sympathectomy. Here we are just modulating it. So I don't think as of now, whatever is the studies which are shown, it should not cause problem when the patient lands in trouble like shock. But to mention definitely in the literature, as of now, whatever renal denervation patients studied, nobody has suffered acute at least reportedly, nobody has reported MI happening after that. But logically, because the system is not totally knocked off, we are only modulating it, it should not produce problem, and patients will still be able to get out of all those problems as usual in any other patient. Nephrology colleagues are also here. Basically, some doubts were raised by nephrology colleagues. That's how the trial is kept on hold by DCGA, and the Venkatram and other committee is appointed again to clear those. But what I want to assure physician colleagues is now this is very safe method, which is very high energies, more than this are delivered in the heart for arrhythmias. The very low currents are used here. So it is found to be quite efficacious and quite safe. Any procedure to come into the clinical use, first it has to prove its safety. That is what is first done in Simplicity 1. You can be rest assured there shouldn't be any problem to kidneys, and there are now data to showing that kidney function is preserved without any fall of GFR or anything on follow-up. If it is not done properly, then if you give the lesions at same point, then you could produce some stenosis. Only one patient of renal artery stenosis is reported out of 2,000 or so patients done. But if if procedure is not done, you can't blame the procedure.
Now it is because of the DCGI approval is not there. But once it is done, what is the anticipated cost of the procedure in any standard private hospital?
No, actually, it may be equivalent to patients taking drugs for 3-4 years. But that's the patient choice. It's not a question of money alone, because in spite of spending all the money for the drugs, pressure was not controlled. So even if it is coming at a higher cost, still it is worth it for the needy patients. But to be precise, as of now, the company is thinking of something like having it around 4 to 5 lakhs. But that what we suggested is the handle could be, again, India, we always innovate some new things. We said instead of having everything new, all the equipment and the handle all could be old, and the only part which goes inside the body, you could make some attachment there, and then the cost could come down to 1 lakh or so. But as of now, they are thinking to keep it around 4 to 5 lakhs.
Thank you,
Thank you.
Dr. Srinivas Kumar.